Hi, I'm Mike Guerrieri with MyInsuranceClassroom.com, and today we're bringing you another Insurance 101. Today we're going to talk about the differences in individual health insurance. For those of you who have never bought your own insurance before, maybe you've been covered by corporate America or covered through your job, or maybe you've just had a policy and not thought about it in years, it's very important that you know the different types of plans out there because they are very, very different and can vary significantly in costs. You know, we probably have all gotten those phone calls from telemarketers offering us the $0 deductible plan for $99 a month. And then there's programs out there that are $2,000 a month. How can plans vary so significantly in cost and vary so significantly in benefits? So hopefully today we're going to take a couple minutes and unwrap some of that and help it make a little bit more sense to you. So in the individual market, there are 4 types of coverages that you can get. The first is going to be the ACA, otherwise known as the Marketplace or Obamacare. This is going to be your most comprehensive coverage that you can get in the individual market. The government has made certain things mandated to be covered. Some of those include things like coverage for pre-existing conditions, coverage for maternity, coverage for contraception, mental health, and preventative care. Now, if those things are important to you, a Marketplace plan is probably best. But if those things are not important to you, you're ultimately going to wind up paying for benefits that you don't need. And so what you're going to find is that the Marketplace plans are typically the most expensive coverage option out there. So why is it called the Affordable Care Act, if in fact it is the most expensive? Well, because if you make below 400% of the federal poverty level, the government will kick in and pay a portion of your insurance. The further below that number you are, the more the government kicks in. And so yes, for many Americans, these do wind up being the most affordable plan because of your income. However, if you make more than 400% of the federal poverty level, these will be the most expensive plan option in the individual market. But the bigger thing that you need to be aware of with Marketplace plans are going to be the networks. Many plans out there through the ACA are HMO plans that make you stay in network with a certain list of doctors and hospitals, meaning that you are not allowed to go outside of that network unless it is a true medical emergency. And so the narrow network oftentimes puts you into the doctors and hospitals that are most affordable for the insurance company, not the doctors and hospitals that are the best across the country. So certainly keep in mind the quality of care that you want when it comes to picking your network of doctors and hospitals. The second plan option is what is called a short-term medical plan. Now, short-term medical plans oftentimes have been intended to fill a short-term need. Someone who is in between jobs, someone who is maybe graduating college and hasn't started their career yet. However, in this day and age, many people are using short-term plans as a viable alternative to the Marketplace. So what do you give up when you go with one of these short-term plans? Well, you give up many of those mandated benefits that we just discussed about the ACA. So what you'll find is that short-term plans will not cover preventative care. They will not cover pre-existing conditions. They will not cover maternity. They will not cover contraception. They will not cover mental health. Which begs the question, what do they cover? Well, they cover anything that goes wrong with you from today going forward. So I like to think of short-term plans very similarly to auto insurance. Your auto insurance doesn't cover your tire rotation. It doesn't cover your oil change. It doesn't cover if you choose electively to modify your vehicle. And it doesn't cover if you got into an accident prior to buying the plan. Your auto insurance covers anything that goes wrong with you from today going forward. That's really what short-term medical plans are intended to do. Cover the medical ailments that pop up once you buy the plan. It could be a heart attack, it could be the flu, and anything in between. But short-term plans will not cover the elective things, will not cover the preventative care. The other thing that you need to be aware of, though, is that short-term plans are just that. They are short-term. And depending upon the state you live in, some short-term plans can be as little as 6 months, as to where in other states short-term plans could be as long as 3 years. But regardless of how long your plan is, at the end of that plan, you need to repurchase that policy every single time, which means the insurance company is looking at your health conditions all over again. And they're deciding if they want you or don't want you as a customer each and every time you renew. So short-term plans can work great for some people as long as you continue to keep your health. So certainly keep that in mind. That's one of the big reasons why these plans are oftentimes half, if not less than half, of the cost of a marketplace plan. Because the insurance company knows that they only have to cover you for a temporary period of time. So third, we have what's called a share plan, or otherwise known as a faith-based share plan. So you may have heard of companies like Christian Healthcare Ministries or Medi-Share. That's what these are talking about. Now these plans are permanent, so you don't have to worry about renewing them like a short-term plan. They often give you access to large PPO networks, so typically you can see any doctor, any hospital, so you don't have the network restrictions of the marketplace. So what are the downside to these plans? Well, first and foremost is they're not insurance. It's you and a bunch of other people collectively pooling your money together in order to pay your medical expenses, which that works great as long as there's money in the pool. But if someone before you depletes that bucket of money, they specifically tell you right up front, we can't guarantee that we have money to pay your claims. So there is a calculated risk with these plans. Furthermore, is that they are faith-based, and they will make you sign a statement of faith. Some companies will have a statement of faith that will say, you can't drink, can't smoke, can't have premarital sex, you have to go to church every week, and if you're not willing to say that marriage should only be between a man and a woman, they won't even let you in the group. And so you certainly have to adapt and agree to their lifestyle model for them to even accept you into the plan. So those certainly are not for everyone. Fourth and finally, the plans that are most common out there through the telemarketers of the world is what are called indemnity plans, or as I like to call them, mini medical plans. These are the plans that you hear about that are $99 a month, no deductible, no maximums, things like that. Well, what they don't tell you is they can give you a plan for $99 a month and have no maximum because there are very strict internal limits. Yes, they will cover your hospitalization with no deductible, but they're only going to cover $5,000, $10,000, or $15,000 of that hospitalization. Yes, they will cover your preventative care right out of the gate, but they will only cover $50 of that doctor's office visit. If you've ever gotten a phone call from someone and they refuse to provide you with policy details over the phone or refuse to email them to you prior to signing up, there's a reason why. And it's because they don't want you to know what those internal limits are. So these plans are great for the little stuff. If your only concern is a doctor office visit here or there, or a prescription, or the occasional test, a indemnity plan might be perfect for you. However, if you're worried about hospitalizations, surgeries, chemotherapy, things of that nature, I would suggest that you stay away from an indemnity plan. So as you can see, the 4 plans can vary significantly, and it can be very confusing as to which plan is right for you. But at the end of the day, you want to make sure that you are going to have a policy that's going to pay for the services you want and need when you have those expenses pop up. Otherwise, what's the point of the insurance? And so talking to someone who knows the ins and outs of all of these things is always my recommendation. Make sure, though, that you talk to someone who works with all 4. Because if you only talk to the person who works with the indemnity plan, what are they going to offer you? If you talk to the person who only works with the marketplace, what are they going to recommend for you? So make sure that you ask if that person works with all of the plans to make sure that they're not biased. So that's our Insurance 101 from today. I hope you got something out of it. I'm Mike Kateri with MyInsuranceClassroom.com, and remember, there are only benefits if you get something out of it.